what is meal support therapy? Meal support therapy is one of the most critical components of the nutritional rehabilitation process in eating disorders. Effective meal support is just not sitting down and watching someone eat. This is an admission pie chart we did last year regarding the age group. We realized that 8% of admission falls between the age group of 17 to 19, and 47% at the age of 20 to 29, and 9% 30 to 39, and 6% 40 to 49. And as you can see, the median age is 23.26 years. And we use a multidisciplinary approach. We are a 5-bed adult eating disorder program in a 24-bed acute ward setting. And admission is by referral, and we do have a pre-admission assessment before the patient comes in. And these are some aims and objectives of meal support therapy: to provide emotional and practical support for our patients, to help individual patients establish a regular and healthy eating pattern. And there are 4 stages in meal support therapy we do: preparation, pre-meal support, during meal support, and post-meal support. Preparation. Meal planning is very crucial in meal support therapy. The patient will sit down with a dietitian and collaborate on meal plans. And this sometimes takes a long time. It's quite a painstaking process. And sometimes a nurse might have to sit with the dietitian to deal with the situation, because some patients are very difficult, as you can see. They want to reduce their meal plan, and they want to add non-fat items into their meal plan, and we don't use low-fat items in our meal plan anyway. And the other crucial point is to check the meals when they arrive on the ward. The last thing you want to do is the meals are wrong, isn't it? And the patient will play out, or they get very angry with us and they won't eat, isn't it? And that would increase their anxiety level. And if there is a discrepancy in the meal plan, we will ring the kitchen straight away, and hopefully that will be rectified. And also, the meal support therapist who's doing the support must be mindful of current patient's anxiety and compliance at meal times. And we have to ensure that there are nutritional supplements on the ward if patient refuses to eat. There is a designated room on the ward where there's a heater and it's quite warm. Patient will get together and we sort of have a pre-meal setting for goals, isn't it? And the patient will decide and note down specific eating disorder behavior they would like to challenge. And also, there are some signals and cues that the meal support therapist can use to assist a specific patient. And signals and cues the patient can use to indicate need for assistance. For example, if someone is struggling at a table or they're playing with their food, the meal support therapist will signal, tap on the table to signal to the patient that not to play with the food or whatever the reason is. And we encourage them to use SMART goals. Basically, they set specific, meaningful, achievable, realistic, and timely goals before they eat. And they write them down in that sheet of paper. When we finish the pre-meal support, the patient will go to the dining room as a group. And the patients will be all seated down at the table, and the meals are brought to them. And sometimes you see patients walking around or standing, they won't sit down, so you've got to encourage them to sit down before they are being served. And we do provide a calm and pleasant environment, and we try to keep the conversation positive and not talk about neutral and fun topics. And the discussion should not involve food, weight, or calories. The meal support therapist will eat with the patient, and be mindful that you're not eating a bowl of salad, because some of the patients have a 3-course meal, and they will see that you might be dieting, or you're not using margin on your plate, so be mindful, because we are supposed to be the role models, and make sure that everybody starts on time, and also try and enforce a time frame for completing the meal to prevent meals from dragging on indefinitely. And this is the post-meal support evaluation sheet, when they finish the meal, they'll come back to the designated room and evaluate their goals. And basically, we ask them whether they did achieve their goal. Were there any obstacles? Are there any adjustments they need to make to the goal to enable them to achieve success for the next meal? And also, what will be their goal for next meal, basically. And they'll talk about this during the post-meal supervision. Be mindful when you are praising them for their achievement, because sometimes this can provoke different reactions in patients, and it's always a very sensitive area. At the meal support, post-meal support, we encourage patients to report their anxiety level from 0 to 10 for pre, during, and post-meal. And the correlated anxiety rating scale will be fed back to the patient at some stage in their stay. And this is one of the studies we are doing is rating their anxiety level before meal. And this is during meal anxiety. And you can see at the start it's always very high, and then you got a spike. Probably there's a meal increase after 2 weeks. And this is a post-meal anxiety level. Post-meal is always a very difficult time for the patients. As you can see, they started off very high in the beginning, and it's slowly tapering down towards the end. And this is a typical fluid and food intake balance chart we do. And we have to record everything on the chart so that we can correlate it, and that's where the research study we had is based on, and the dietitian will calculate the calories intake per kilojoules. And in that part, you got the anxiety level rating scale. And this is some of the post-meal activities we do after they've eaten. And we've got provision for psychoeducation and support. And also we engage them in chillax activities, like watching a DVD, relaxation, quiz, art and craft, and there are other directional activities they can do. And these are all the guidelines, and I don't know whether I should go. Have I got enough time? Yeah. This is just the guidelines for the meal support therapies. We've got to make sure that we are all on the same page to be consistent so that patient can't manipulate one stuff or split us. These are all the guidelines highlighted here. Yeah. If the patient is 100% non-compliant, we offer them a nutritional supplement. And if they continue not to comply with the supplements or the main meals, we will bring this back and discuss at the team meeting and decide what to do. We do use nasogastric tube feeding, and that's only a last resort. And also some patients are separated at the table for therapeutic reasons. If someone is overly anxious or disruptive, we separate them, and they will be meal support on a one-to-one basis. And we try not to, anyway, because we try to normalize eating behaviors as a group rather than do it individually. And also we have no freezing of food or overheating of food. And especially we don't allow them to bring bags at the table, because you got some patients who hide food or chart food or whatever. And also with the misuse of serviettes. Some patients, they spit food into the serviette, or they use the serviette to wipe off the margarine from the sandwiches. So you just have to be mindful. Yeah. And we commence post-meal supervision in the designated room, an hour for main meals and half hour for snacks. And we also lock up the bedroom and bathroom during post-meal supervision as per management plan. This is to prevent someone rushing to the toilet, and obviously they might vomit or whatever, so it needs to be supervised at that time. And also no visitors until post-meal supervision is completed. Okay. And this is the conclusion. We know that meal times are the most difficult times for our patients, and that meal times can be extremely tense, emotional, and stressful for both patients and meal support therapists. And meal support can be a very difficult thing to do and to receive. And it is important to remember that each patient you meal support is individual. supporting someone with an eating disorder at mealtimes is a very personal and challenging thing to do. And also be mindful when complimenting someone for completing her meal, as this can provoke different reactions in patients, and it is a very sensitive area. And be non-judgmental and non-confrontational. This is quite difficult sometimes, to be non-confrontational, especially when you get a very difficult patients who try to disrupt at the table, hiding food, swearing and abusing you. So, and the last but not least, it's important that patients feel that their efforts are being acknowledged and that others appreciate what an achievement it is for them. And for some patients, this can enhance shame, guilt, and loneliness. Yes, group of 17 to 19, and 47% at the age of 20 to 29, and 9% 30 to 39, and 6% 40 to 49. And as you can see, the median age is 23.26 years. And we use a multidisciplinary approach. We are a 5-day adult eating disorder program. Nurse might have to sit with the dietitian to deal with the situation, because some patients are very difficult, as you can see. They want to reduce their meal plan, and they want to add non-fat items into the meal plan, and we don't use low-fat items in our meal plan anyway. And the other crucial point is to check the meals when they arrive on the ward. The last thing you want to do is the meals in the 24-bed acute ward setting. And admission is by referral, and we do have a pre-admission assessment before the patient comes in. And these are some aims and objectives of meal support therapy: to provide emotional and practical support for our patients, to help individual patients establish a regular and healthy eating pattern. And there are 4 stages in meal support therapy we do: preparation, pre-meal support, during meal support, and post-meal support. Preparation. Meal planning is very crucial in meal support therapy. The patient will sit down with a dietitian and collaborate on meal plans. And this sometimes takes a long time. It's quite a painstaking process. And sometimes what is meal support therapy? Meal support therapy is one of the most critical components of the nutritional rehabilitation process in eating disorders. Effective meal support is just not sitting down and watching someone eat. This is an admission pie chart we did last year regarding the age group. We realized that 8% of admission falls between the age